Hi, thank you so much for coming today. I really appreciate it.
Mm.
I'm looking forward to, but I'm nervous about this new treatment that you've been talking to me about.
Mm-hmm.
Okay. If I'm getting this correctly, Gua Sha?
It's Gua Sha.
Gua Sha. Sorry. Okay.
That's okay.
It's all still new to me, but as you know, with my afflictions and stuff, I'm at the point that I need help and I don't want to go to surgery.
Of course. I mean, we always want surgery should always be a last resort, right? Because it's so invasive. It's cutting your body up.
So funny that you should say that because that's actually the first option my doctor went to.
Really?
Yeah, he did. It was sort of like try a bit of physio first, which I've been doing physio on and off for a few years. That doesn't work.
Yeah.
And then when this new affliction came up, and I'll explain it to you in a minute.
Yeah.
First option, here's a referral to the specialist. Surgery, day surgery, it'll fix it for you. And my experience with surgery, I don't want to go down that path.
Oh,
So
okay. It's understandable. Yeah.
at this point, willing to try
Anything. So, what exactly is wrong? I
Okay.
mean, what are the issues?
So the issues that I've been having is for a few years, as you know, I've been getting cortisone injections in my shoulder because I have a tear in my rotary cuff.
Yeah.
But the last 3 years or so, if not a bit more, I've been getting more numbness in my hands, primarily the right side. It's now gotten to the point where I can't feel my right hand with the numbness, and the left hand is now afflicted. So it's starting to get afflicted.
Oh.
So I went and had a few more scans and tests done. So what's come up is that I've got worn discs in my neck that are impinging on the nerves, and that's causing the numbness. It's basically wear and tear due to my age and my job, because I'm an admin person and all my work is based is sitting down on a computer. I'm right-handed, using the mouse and typing away. So it's wear and tear.
Yeah, I think a lot of people can relate to that thing, having using the computer a lot.
Exactly.
Yeah.
You know, their advice was, switch using the mouse from the right to the left hand, which I've tried, but it's a lot more difficult to readjust. And as I said, the physio sessions and all that, nothing's working. Nothing's settling it. So the doctor's advice was to see a orthopedic surgeon, where it was a simple case of day surgery, where they go in and they're going to shave a bit off the muscle and a bit off the bone to release the pressure on the nerve, and that should settle everything down. But like I said, nothing is ever how they explain and they say, and I would like to avoid that.
If there's something else we can do that's even better than we'll fix it without the surgery.
Exactly.
Yeah. So his advice before was give you cortisone injections.
Cortisone injections.
What does that do? What's it supposed to do?
All it does really is numb the pain. They're supposed to last. Injections technically last, I was explained, they can be from anything from 1 to 3 months, 1 to 6, or 12 months. I've been lucky where they've been lasting me 12 months, sometimes 18 months. I haven't had to have one yet this year because the pain in the cuff is fine. Doesn't warrant me to go have another injection done. But what I'm finding now is the pain in my neck is actually quite significant. So even if I turn really quickly to the side, it's like shooting pain down my arm. And primary example, I went swimming last summer.
Yeah.
You know, and we can swim because we've taught since we were little.
Yeah.
I can't do freestyle, because the fact that you're going like this and you're turning your head in the water.
Yeah.
It was just I couldn't manage it. It was too painful. Happy to swim like a butterfly or a doggy paddle, but to do your proper freestyle swimming, couldn't do it. So I'm starting to get limited with what I can and can't do. A simple action of washing dishes in the sink. I've broken so many dishes and glasses because they're just falling out of my hands because of the nerves. I'm not feeling them.
Really, besides the pain, it's actually affecting your life.
Yes, it's affecting other areas now. So it has to be looked at. But like I said, surgery is a
Yeah, I mean, like, and
Preferably no option.
Yeah, so those cortisone injections are they're basically just a painkiller.
Yeah,
Doesn't fix it.
No, because it's been 10 years now that I've had the issue with the rotary cuff.
Yeah.
Okay.
Yeah.
And I'd say close to about three to five where the deterioration on the neck has started. And this year, especially, it's been more noticeable. And
Oh, okay. Do you realize that cortisone injections are actually steroid injections?
yes, and I know, and they do. They're not very good for your bones because it sort of like makes them crumble.
Yeah, and also it does affect your
Weakens.
immune system as well.
Yeah.
Which most people don't realize because the doctor doesn't tell them.
Yeah.
Tend not to tell people patients the full implications. So, well, that's just masking the issue, isn't it?
Yes,
Yeah.
it is.
So, well, if you're willing, we've heard Gua Sha. It's a practice. I mean,
I still keep thinking Gua Sha in my head. That's so bad.
That's okay.
Sorry.
Or you can just refer to it as scraping. Okay, most people are familiar with cupping.
Yes.
Yeah, you know about cupping.
Yes, I know about cupping because I've experienced it and seen it from when I was younger. My grandmother used to actually do it.
So. Yeah, and I think a lot of people are familiar because they're seeing all these cupping marks on these athletes that tend to be having them nowadays. And and because of they seeing that, I guess people are not put off by that. They're thinking, okay, the athletes do it, and I guess it's more relieving muscular pain. But now, not many people are familiar with Gua Sha or scraping, simply because it's not used as widely enough because it's far more labor intensive. You actually go in, but it's more targeted and it goes deeper.
Okay.
So but the flip side is it's more labor intensive, but you know what? It's far cheaper for people to do.
Are there any side effects for it?
No, only that we advise you not to get the area wet before afterwards. If you need to shower beforehand. Otherwise, you don't get it wet for 24 hours.
So I've come to you because I've known you for so long and you are the queen of natural therapies. Okay? The queen. And I've seen your stuff firsthand.
Yeah.
So I want you to try it on me.
Okay. The reason why you don't shower straight afterwards, is because Gua Sha actually opens up the channels in your body. And so you don't want to introduce dampness into it, allow dampness to go in. So that's why we say avoid showering or getting it wet for 24 hours. So shower beforehand.
So explain to me, what is Gua Sha?
Okay. Gua is scraping and Sha is toxins. So Gua Sha means scraping toxins. So basically scraping the toxins away, kind of like when you're buttering your bread, okay, with a scraping. And it's an ancient Chinese practice, health practice, and it is a part of traditional Chinese medicine. Now, traditional Chinese medicine, or TCM for short, it has a lot of tools. I mean, most people are familiar with acupuncture, and of course the cupping, most people are aware of, but the Gua Sha, the scraping, is well known for reasons I explained before. It's a lot more labor intensive, so people don't really want to do it. And that's why they don't offer that service as much. When you walk into one of those Chinese massage places and they advertise they also do acupuncture or cupping, very few of them would actually say, we do scraping or Gua Sha.
No, I haven't seen it.
Yeah, for that reason, that's the reason why they do it. But it does deal with basically the meridians and the qi flow in your body, which traditional mainstream medicine doesn't deal with at all. Okay. So this is outside of what they do, and it's an alternative for things that they can't deal with. So this is why we're here. So
excited, nervous.
Now, traditionally, what they do is they didn't use a coin. They didn't use scraping with a coin and cooking oil as a lubricant on your body, which isn't very appetizing. So what I've done is I've developed my own balm. I've been calling it Sha Ving Balm. And Sha, for when I explained it, it means toxin.
Yeah.
Okay, Ving and shaving, just like with shaving cream, there's shaving balm.
So it's sort of like a play on words. I love it.
Okay, so what it is, it's a balm. Instead of cooking oil, have a look, have a smell. It is a warming. So what does that remind you of?
It's very calming.
Calming, yeah.
It's very calming. Inviting.
But also, yes, it provides a lubricant on your skin. So
I've got like a minty. Yeah, it's very nice.
So it goes right in. It also warms up the area. So it can also be used if you've got some pain, general pain, and people use it like a deep heat, so to speak. Okay. And the reason why it needs to be warming is because when we're scraping, we've opened up the channels. It needs to be kept warm. So during and also afterwards, you've still got that area being warmed up, so to speak.
Would
we use in place of the coin? So it's kind of like an all-in-one.
Okay.
Say, and then you can place it. So,
question. Sorry. Would the peppermint, because you know how you said you're going to be scraping, so it'll open up the channels.
Yeah.
Does it sort of act as, let's say, an antiseptic or anything like that? Will there be stinging or anything like that?
Surprisingly, no stinging.
Because you know how sometimes with Vicks and deep heat and all that, you get the burning, stinging sensation?
Yeah.
I can't do it.
I haven't had anyone say that.
Okay.
After having it done. Okay. So, but also because we kind of like do open up the channels and it's rubbing the skin, best thing is you want to use a natural product. Yes. Not one. I know there's others that people think it's natural because it's part of Chinese medicine, but the carrier they use is like paraffin. And paraffin, if you didn't know, it's petroleum. So you're literally going to be rubbing that onto your skin and absorbing into your body, which people don't realize because not everyone looks at the ingredients list.
Yeah, no, I don't. To be honest with you, I don't.
It's a practice. A lot of people don't, and so they don't realize they're rubbing petroleum into their body.
Wow. So
that's why it was very important, and to make sure that it's all natural. Okay. If it's ingredients you're happy to swallow into your mouth, you're fine to just rub it into your skin.
Yep. Perfect.
Okay. So, we'll get started.
Yeah.